Good morning, everyone. My name is Suzanne Templin, and I coordinate the webinars for Hausmann Insurance. I would like to welcome you to today's webinar titled Large Employer Medical Funding Strategies and Captives. Today's webinar will run about 60 minutes. After the webinar, we will have a question and answer session. If you have a question during the webinar, feel free to type it into the chat feature, and Jesse will address it during the Q&A portion. After the webinar is over, there will be a short survey we are hoping you can fill out for us. A note that this webinar has been certified for continuing education credits by the Society for Human Resources Management and the Human Resources Certification Institute. Details on those credits will be provided to you at the conclusion of this webinar. Also, please be aware that this webinar is being recorded and will be available for review on the webinar archives of our website. If you do not want to participate in a recorded webinar, you may want to close at this time. I will be emailing everyone who signed up for this webinar with a copy of the presentation and a link to the recording. I would now like to introduce you to our presenter for today's webinar, Jesse Oberlo. Jesse capitalizes on his 15-year background in risk management and account services to develop benefit programs for clients of Hausmann Insurance in a way that improves the overall health and productivity of the workforce. He is an expert in alternative funding methods for insurance, including self-funded, limited funded, and captive plans. By staying well informed on the latest industry trends, Jesse is able to provide proactive and strategic solutions for benefits clients. Prior to joining Hausmann Insurance, he was a manager of member services at the Alliance. He is a member of the Wisconsin Association of Health Underwriters and participates in local community chambers and SHRM chapters. Jesse graduated from the University of Wisconsin-Madison with degrees in finance and investments, risk management and insurance, and human resources management. He has a wealth of knowledge to share, and we are so thankful to have him presenting for us today. Welcome, Jesse.
Thank you, Suzanne. Good morning, everyone. As Suzanne had alluded to, today we are going to talk a little bit about employer medical funding strategies, and really the highlight of the presentation is going to be on captives. So what I'm going to do is I'm going to take about 15-20 minutes and just run through the basic overview of the different funding options that are available to employers. And then from that, we'll spend the latter half of the presentation taking a little bit deeper dive into group health captives and talk about what they mean, how they work, and discuss how you might evaluate whether or not they might be a good fit for you and your organization. So we'll start off this morning talking about the different funding options that are available. When we get into the different funding options, we could probably spend an hour on each one of the different options that are out there, so really going to stay high level on this. And from that, we'll talk a little bit about what you should be thinking about when evaluating these different funding options and how to select the appropriate funding method for your organization. I'll highlight a little bit on the advantages and disadvantages of each one of those options, and then, like I said, we'll take probably the last 20 minutes or so to take a closer look at captives, talk about their emergence into the market and how they work. So overall, we'll probably spend about 45 minutes on the presentation, and then, like Suzanne said, if you have questions throughout the presentation, just go ahead and type those in, and then we'll have a question and answer session at the end of the presentation. So when we talk about the different funding levels, it really comes down to two variables or two kind of areas on the spectrum: the risk, reward, and liability. And you can see, as that arrow goes from fully insured over to self-funded, your risk, your reward, and your liability within your organization goes up. And then on the flip side, your fixed costs are going to go down as you move from right to left on that spectrum, from self-funded to fully insured. Of course, if you're a fully insured plan or offer a fully insured health plan, 100% of your cost is fixed because you're paying a monthly premium to the insurance company. If you're self-funded, your fixed costs are going to be in that 15 to 25% range to pay for the carrier or the vendor services that you need to outsource in order to help manage your plan, but the lion's share of the risk and the reward is going to be fall onto you as the employer, and your fixed cost is going to be very minimal at that 15 to 25%. We're going to spend a little bit of time today on level funded and shared funded plans, but really, that could be a whole presentation in itself, and today we're going to highlight on captives. So I'm going to touch real briefly on level or shared funded plan, but just know about 80 to 90%, depending on how they're set up, in fixed costs. There's some minimal risk reward that's available within those plans, and those plans can also be fully insured or self-funded, depending on how they're set up. So a quick review of the different options that are available. Fully insured, which is probably the one that most of you are most familiar with. And really, when we look at a fully insured plan, the insurance plan and the insurance company assumes the full claims liability. What that means is that the insurance company holds the fiduciary responsibility for that given time period. You sign a contract with them. That contract then guarantees you fixed monthly premiums. Those premiums are set prospectively, so they look at, prior claims experience. They look at prior history of how the health plan for that insurance company has performed. But then those fixed monthly premiums are guaranteed for that duration of the plan year. So that means they cannot be adjusted for poor performance during the plan year, and they're guaranteed for that 12 months. Many of you know, especially if you are experience rated on the fully insured side, that if you do have a bad year, your grades are guaranteed, but that following year, that the plan experience will definitely be reflected in your next year's premiums. Additionally, with fully insured plans, there's no additional cost at termination. Fully insured plans are set up on an incurred contract. What that means is that the insurance company that you have the plan with are liable to pay any claim that was incurred during that plan year. So if you have a 12-month calendar year plan set up and an employee incurs a $50,000 claim on New Year's Eve, and you end up leaving that health plan the next day and going with a competitive carrier, or you move to a self-funded plan, and the bill is not submitted by the insurance company until February for that $50,000 claim, the fully insured carrier for that 12-month time period, when the claim was incurred, is still liable to pay that claim, even though the bill didn't come in until afterwards. So that's just an interesting note when you're distinguishing between the different plans, that knowing that the fully insured plan, the insurance company is set up on an insured contract, so they're liable for any claim that was incurred during that 12-month period. And then finally, another note that distinguishes fully insured plans from the other two options is that fully insured plans are subject to all state mandates, and they're also subject now to some additional ACA regulations, and we'll talk a little bit more about those in the advantages and disadvantages. So I mentioned earlier experience rating, and I just wanted to go a little bit deeper into the different types of ratings as it relates to fully insured plans. Really, there's two types of ratings: community rating and experience rated. Community rating is based on the carrier's pooled experience for all plan members within that given plan, and it's adjusted for age and sex factors for you as the employer. Now, with the advent of ACA and healthcare reform, any employer under 50 employees, all the plans are now community rated for that population, 100% community rated. So regardless of how your plan experience performs, you're going to get rated based on that pool of all of the employers that have selected that plan for that insurance company and how they filed their rates with the OCI, the Office of the Commissioner of Insurance. Now, groups over 50 employees are often have some element of experience rating. And experience rating is just really looking at premiums or looking at calculating the premiums based on the specific plan own claims. So what they do is they often look at 2 years worth of claims data for you as a specific group, and they're going to adjust those claims for trend, any plan changes or any demographic changes that you've had within your population, but they're going to use those prior year claims to help project what they believe future year claims will be. Now, almost all plans are rated based on a combination of these two methods. So rarely is a group 100% experience rated, and that's going to come back to, again, it's based on the group's credibility and how a fully insured carrier determines how credible you are as a group is based on the number of covered lives that you have and also the number of years that you've been with them underneath that particular plan. So typically, a 150 employee group might be 40% experience rated and 60% community rated. So that's interesting to note because, again, as we talk about these different funding methods, even if you're experience rated to some extent on a fully insured plan, there's often this community or pooling portion of the rate calculation where they're going to base at least part of your premiums on their total population as it relates to that particular plan. Everyone, meaning everyone who has that particular plan versus just looking at you as a isolated entity and only using your claims experience to calculate your premiums. Now what that often does is for groups that are running better than the pooled group, they're going to be rated up or they're going to help offset the costs for some of the losses within the pool for the employers that didn't run so well. And then vice versa, if you're running above the expected or above what the rest of the pooled group is doing, that community rating can help level off or bring your premiums down a little bit. So depending on, again, where you fall that given year in the spectrum, how the breakout is between experience rated and community rating can have a positive or negative effect on your overall premiums. Level and shared funded, again, I'm going to really stay high level on this. I could do, probably will at some point, do a completely separate webinar on level funded plans. But just know that essentially you maintain a fixed monthly premium that's set by the insurer or even the self-funded carrier and the stop-loss carrier in some cases. But essentially it allows for some financial reward if the plan performs better than expected. So as we talked about a couple of slides earlier, it's usually in that 80 to 90% range when it comes to your fixed costs. There's some sort of a risk-reward corridor depending on how your plan performs. If your plan performs better than expected, you can get some money back at the end of the year. Sometimes, depending on how the plan is set up, that's credits for future years' premiums. And other plans, you'll actually get compensated or you'll get a check at the end of the year if the plan performs better. Some of these plans ask you to fund at the maximum so that there is only a reward corridor. Others have you fund at the expected and then you take on some risk and there's some reward. So they might set your claims at 100% of what they expect the claims to come in at and say if you perform better, we'll give you up to 15% back. However, if you perform worse, we might bill you an extra 10% at the end of the year if you're running over what the expected amount would be. So there's, again, that some level of risk, but still has a high level of fixed costs, and the amount of risk that you're taking on, as well as the amount of control over you have over a lot of the variables, is still pretty limited. So it's a good way for employers that are fully insured, but looking for alternatives, looking for a way to potentially capitalize on their positive years to start thinking about self-funding. But again, there's very little risk-reward corridor when you compare it to a self-funded plan. So self-funding, kind of as opposed to fully insured, the employer assumes the claims liability and has the fiduciary responsibility. So the employer is the plan owner. This is one of the biggest differences when it comes to self-funding and fully insured. You as the employer, when you self-fund, are the plan owner and you have that fiduciary responsibility. So with that, of course, there's a little bit more on your plate from an HR standpoint as well as a management standpoint. Again, the monthly costs are going to be variable based on the claims experience, and payments are made retrospectively. So you only pay claims after they're incurred versus paying a fully insured carrier a monthly set fee regardless of your experience for that given month. The employer then, bullet point 3 there, the employer is liable for claims incurred at termination. So just like we had talked about on the fully insured side, if you were to leave your self-funded plan and go back to fully insured, or if you decided that you were no longer going to offer health insurance and you were going to just pay the penalty with ACA, or you end up being sold or acquired by a different organization, when you're self-funded, you have the fiduciary responsibility to pay any claim that was incurred during that plan year. So you need to continue to pay claims that were incurred during the plan year even after the plan terminates, because often the lag time for billing, especially for a lot of major hospital services, could be anywhere between 3 to 6 months. So one thing to consider when you're looking at self-funding is just knowing what that runout or what that termination liability is going to be if the plan were ever to terminate. How much additional claims will you need to pay or fund after the plan is put to bed. And then finally, the self-funded plans are subject to ERISA but not state mandates. What that does is it allows for flexibility, especially with employers that have multi-state locations. Allows them to offer one plan across all locations without having to worry about being in compliance with each individual state and their state mandates. So when we look at stop loss, when we look at self-funding, stop loss insurance is really the way that employers can protect themselves from catastrophic claims. There's two types of stop loss that can be purchased, and usually they're purchased in conjunction with one another, and that's specific stop loss and aggregate stop loss. Specific stop loss covers individuals, the individuals on your plan, all of the employees, all of the dependents, at a certain dollar amount for that given plan year, so that any claim exceeding that amount will be covered by the reinsurance carrier. So a specific stop loss really just determines the level of risk that you as the employer want to take on each one of your individual employees. That specific level can be set at anywhere between $25,000 and $250,000. So there's a wide range, again, of you as the employer being able to determine how much risk you want to take on your self-funded plan. The aggregate stop loss is for claims costs on the plan as a whole that exceeds a certain dollar amount, which is called the attachment point within that given plan year. This attachment point is set at usually 120 or 125% of expected claims. What it does then is it gives you a ceiling to know what your total liability for the plan will be if you have that catastrophically bad year. Often aggregate stop loss insurance is referred to as CFO sleep insurance because it allows you as the HR team to go to your finance team and tell them this is the maximum liability that we will take on being self-funded this year. One thing to note is any claim that is over the specific stop loss amount does not get applied to the aggregate stop loss amount. So if you had a $50,000 stop loss on an individual and you had a catastrophic event with one of your employees and they had a $300,000 claim, again, you would pay the first $50,000 on that claim. The additional $250,000 to get up to that $300,000 amount would be covered through the specific stop loss. However, that $250,000 that was paid by the specific stop loss is not going to be applied towards the aggregate stop loss. So with that being said, the only way you would really hit your aggregate stop loss is if you had a lot of your employees have some claims but not have the catastrophic claims. So again, at that $50,000 example, you could have 20-30% of your population hit $50,000, but nobody have that catastrophic claim. That might come into play. But again, when you look at the two variables or look at the two stop loss contracts, the specific stop loss is going to be the more expensive one, as you can imagine, having that cap on each individual. The aggregate stop loss is relatively cheap and really often is purchased by the employers just to have that kind of comfort of knowing this is where our ceiling is and knowing kind of what our maximum liability is going to be for that given time period of that plan year. So when you're looking at which option is best for you, there's a handful of things that you're going to want to consider. First and foremost is really what's the risk tolerance of your organization. When you think about your executive team, you think about finance, think about other decisions that you've made within your organization, how much risk do you want to take on? And if you're a company that does not like risk at all, then fully insured is probably where you want to be. If there's, again, looking at your potential options, you want to get a little bit more involved. As you move down that risk spectrum, there's the options of level funded, and then there's the option of self-funded as well. The other thing to consider is we want to consider cash flow considerations, really thinking about how liquid is your organization. As you can imagine, when you're self-funded, you're going to have some months where you're going to pay less in claims, and then there's other months where you might have some high dollar claims, you might have some high utilization, and you're going to need to pay out a little bit more. So just knowing kind of how liquid your organization is, how readily available is cash to pay that. And oftentimes employers, when they self-fund, will set up a separate bank account, and they'll fund that account similar to paying claims on a monthly basis as if they were fully insured. So setting up premium equivalents for each individual within your organization that's on the health plan, and then setting aside that money in order to pay or fund the health plan so that you have some money set up over there. Employers will also go as far as, any excess money that they have at the end of the year. Sometimes they'll set up a reserve fund as well for future years, so that if they do have that bad claim year, if they do have that higher than expected claim year when they're self-funding, they already have that money set aside in reserves versus needing to go to other areas of the balance sheet in order to pay for those claims. Another thing we're going to want to consider is the size of demographics of your workforce. When you're looking at a standalone self-funded plan, kind of the traditional self-funded plan, usually the mark we talk is about 100 employees. You need to be at that 100 employee mark in order to feel comfortable to do self-funding. Now, if you're looking at the limited funded or level funded plans, you can definitely go to that 50 to 100 range, and we'll talk today a little bit more about the captives, but captives are allowing employers as small as 50 employees into a lot of these captives that we've been working with. So there are some alternatives for groups in that 50 to 100 employee range. The other thing to think about is how stable is your organization as far as the workforce goes, and then also, are you growing? Usually employers that are in growth mode are more apt to be able to self-fund than if you're looking at potentially facing downsizing in the upcoming years or worrying about layoffs or making cuts. Self-funding, then again, you might not be that risk-tolerant organization if you're dealing with those types of issues. Also, thinking about what the average age and what the breakdown of single and family mix is within your plan. Of course, the younger your population, the healthier they're going to be, and the more favorable you're going to have as a claims experience. But also, when you go back to thinking about that pool with the fixed cost of the fully insured plans, if you're the young, healthy population and you're running at 70–80% for a loss ratio every year, you're part of that pool that's helping offset the costs of other employers that maybe aren't as young or as healthy. So again, that would make you a great candidate to look at some of these alternative funding levels. And then the other thing you really want to know is, if you can get the information, if you're fully insured right now, is what's the current health status of your population. Knowing how sick your group is, what kind of conditions do you have going on. Again, not on an individual basis. You don't want to get into the HIPAA concerns with that, but just knowing what's the prevalence of diabetes within your population, what's the prevalence of coronary artery disease, and then those different chronic conditions. Because if you have the higher percentage of those in those populations, again, maybe self-funding might not be the best fit for you. But on the flip side, you might be sitting back thinking, well, we're fully insured, we have 120 employees, and I haven't seen any data like that from my fully insured carrier, so I don't even know what the health status of our population is. Well, that is one of them. We'll get into that in a little bit, but that is one of the advantages of self-funding, is really understanding that data, understanding the claims and where your dollars are being spent, so that you can do a little bit more as it relates to wellness, employee education, and those things. So if that's something that you're interested in, and your employer and your executives are interested in learning more about, how are we spending our dollars, again, these alternative funding levels or funding methods would be potentially a great fit for you. Also, thinking about geographic location, as I mentioned earlier, because self-funded plans are not subject to the state mandates, Employers that have multi-locations and multi-states are able to offer a consistent benefit plan across state borders, which is very beneficial, especially from an ease of administration standpoint from you and the HR department. Also, oftentimes employers, when they're able to offer a self-funded plan and offer that one consistent plan across the board, it helps with the employee morale. We were just talking with a group last week that had about 75 employees here in Madison, but then they had another 30 or 40 spread throughout the country in a couple other locations, as well as the sales staff that they had. And one of the issues that they ran into is they said that they've gotten a lot of feedback, because they're fully insured right now, from those employees that are outside of the greater Madison area, that they feel like their plan and their benefits aren't as well put together, or aren't comparable to what the employees in Madison have, because they're going through one of the HMOs here in town, and they're offering a PPO option to those that are outside of the primary HMO service area in Madison. So one of the alternatives, again, and one of the things that we talk to this employer about, is looking at what their options may be on that self-funded capacity, whether, again, it's level-funded, captive, or going completely self-funded on a standalone basis. The nice thing is there that you could offer one plan to all of your employees now, regardless of the state that they live in, and you offer that consistent benefit to everyone that's working within your organization. And then finally, really, you want to consider what's the level of involvement in managing the benefit plan. As you can imagine, as I've alluded to a little bit here, self-funding employers or self-funded plans require the employer to be a little bit more hands-on. So what you want to think about from an HR standpoint is how much support do I have from a leadership standpoint? Am I being given the resources needed to manage a self-funded plan? Am I looking for more control in the plan design? As I was talking about earlier, do I want more access to reports and analytics? And then how much of a priority is wellness? If wellness is a big priority for your organization, looking at self-funding might be a very viable option for you, because being self-funded, you're actually going to be able to reap the rewards of the wellness plans that you put in place versus, again, with the fully insured plan, oftentimes, regardless, your wellness efforts are really only going to benefit the fully insured carrier and help them in their bottom line if you perform better than the premiums that were set up at the beginning of the plan year. So going through real quickly the advantages and disadvantages of the three different funding methods that we talked about. Again, with the fully insured plan, the fiduciary liability is on the insurance carrier. That's one of the biggest advantages. It's really kind of, takes you and your liability away. You pay the premiums and you let the insurance company worry about the liability. It's straightforward. It's easy to understand. Cookie-cutter plans. The administration is outsourced to the insurance company. They handle all the disease management, the case management, the wellness, the pharmacy contracts. All that's handled by the carrier. You just pay your premiums and kind of let them deal with it. From a finance standpoint, you're able to set the budget for the entire year. You know your costs, and that makes it predictable. Makes it simple. Unfortunately, over the last decade plus, the predictability in this marketplace has really been a 10 to 15% rate increase on an annual basis. So it is predictable, but we've seen that predictability means that you're looking at a trend of 8 to 10%, even on a good year. Disadvantages, we talked a little bit about this earlier, but just the lack of control in benefit plan designs. This is becoming even more prevalent with the ACA regulations. A lot of fully insured carriers are reducing the number of plan options available even for large employers, which makes it more of that cookie-cutter approach, one plan design fits all. The fixed costs include premium taxes, ACA, now there's new ACA premium revenue fees. There's the risk margin the insurance company puts in, as well as their profits. So just know that these fixed costs alone are an estimated 10 to 12% of the total premium that you're paying. Many of these fees can be mitigated or even completely removed on a self-funded plan. Yeah, another disadvantage is you must include all of state mandates. Now, most employers will comply with state mandates. Where you get into trouble and makes things a little bit more cumbersome is, again, with that employer that has multi locations in multi-states and just making sure that you're offering each one of the state mandates for each one of the carriers or each one of the plans being offered. Now, one way around this is that some of the national fully insured carriers, they have it down. Each one of the plans that they offer in each one of the states is going to, of course, be compliance with each one of those mandates. But where the disadvantage comes into play is then it's very difficult then to offer one plan design across state borders if that's a goal of yours as an employer. Also, the geographic restrictions on coverage, just know that here in Madison, for example, we have a great variety and options of HMOs, and it might be great for your employees here in Madison, but those same plan options might not be so great for the tenant field or sales force that you have spread throughout the country. And then the last one are, the lack of data and reporting. We'll get a little bit more into that, but, that's been a frustration for a lot of employers over the years. It's just the lack of information that they get from the fully insured carriers. And then, rarely are you rewarded for a good plan performance, but almost always penalized for a poor. Again, if you're experience rated, if you have that bad year, the insurance company is going to adjust to recoup for their losses. However, rarely have we seen it that if you run at 75% or 60% of the expected claims for the given year, have we seen, a 10% decrease? When was the last time you heard employers say that my fully insured carrier reduced my rates this year by 10% just because we had a good year? Rarely does that happen, and rarely you get to take advantage of the good performance years when you're fully insured. When we look at self-funding, a couple of the advantages of self-funding is, again, the greater plan design and vendor flexibility and control. You can offer one plan across all locations. You can be creative with incentives with steerage to high-value providers. You can select the individual pieces of the plan that work best to meet your specific needs as the employer. So I'm talking about the pharmacy, benefit manager, the disease management, case management, wellness vendors. You're able to select each one of those pieces and really determine and work with, best in class in a lot of these and what meets your needs. So if you think about a wellness company, for example, you can go out and find that health risk assessment wellness company that's all they do, versus some of the fully insured carriers will offer health risk assessments, but it's an add-on. It's something that they do in addition to the insurance piece. As I touched on earlier, one of the advantages, which is also a disadvantage of the fully insured and advantage of self-funding, is that lower fixed costs, lower taxes, fees, and fewer mandates. So it can eliminate much of that 10 to 12% load in those fully insured plans. You're going to have increased cash flow. Really, you're going to have some increased cash flow just based on how claims are paid. Again, you're going to pay the claims after they're incurred versus up front. So there's a little bit of cash flow here. That's not a huge advantage for most employers. But the access to the data and the reporting to give you visibility into the healthcare cost drivers really is. So when you start thinking about wellness and you start thinking about employers wanting to understand a little bit more about how they're spending their dollars as it relates to health insurance benefits, you as the owner of the plan, the self-funded plan, you have access to that data, and you have access to a lot more data than you would ever get from a fully insured carrier. And again, as we've talked a couple of times, you're directly rewarded for the positive performance. You get to keep the money that's not being spent, and you're also able to set your risk level through the purchase of stop loss. So you're able to choose the level of risk that you want to take on as an organization. So the disadvantage of self-funding is you as the employer, again, you hold that fiduciary and legal liability for the benefit of for the plan benefit being offered to your employees. So what that means is that if an employee wants to appeal a claim that was being denied, ultimately you as the employer, you're the final decision maker as to whether or not that claim is going to get paid. There's additional HIPAA concerns, as you might imagine, having access to this information, and you need to make sure you're in compliance with the changing regulations. The variable claims and costs throughout the year, the variability, just know that 1 in 5 years you're going to have what's deemed a bad claim year, so you need to be prepared and budgeted for that. Lasers, I'm not going to get too much into lasers today, but just know that there's some additional liability for those with known health risks, where sometimes stop-loss carriers will say on that specific stop-loss premium that we talked about, we'll give you $50,000 coverage on every employee other than employee X because we know they're on a waiting list for a liver transplant, and for that person we're only going to cover claims above $250,000. And suddenly you have this additional $200,000 risk that you didn't have the year before. Again, the larger administration burden on the employer to manage the health plan. As the plan owner, more is going to fall on your shoulders, and especially there in HR, so be prepared for that. And then also just know it can be difficult to switch back to fully insured, especially if you're coming off a bad claim or then one of those bad claims years. The risk may get denied by the fully insured carriers. So a fully insured carrier might say, hey, you know, we're going to deny to quote you because of your health status or your population, and then you're stuck with being in that self-funded. So just understand that self-funded is a long-term commitment, and you want to really be ready to make that commitment before you make the leap into self-funded. So now that we've went over these, you know, I've revised kind of that original diagram that we had earlier. And just as you can see here, really when you look at the risk, reward, and liability spectrum, fully insured and level or shared funded are way over on the far left. Very little risk, very little reward on that. But then the self-funded spectrum is a very wide spectrum. And one of those that fall within that spectrum is captives. So I'm going to spend about the next 15, 20 minutes talking about group health captives and how they work and talk about how they might be a good fit for you. So group health captives is an insurance facility formed by companies joining together to reduce the cost and risk of insurance. So they provide insurance to and are controlled by their owners. So captives, a brief history on captives. Captives as a whole started back in the 1500s. Ship owners came together when they were going across the Pacific and the Atlantic, and they said, hey, we're all transferring goods overseas, and we know that there's going to be a handful of shipwrecks, so let's pool all of our money together so that if one of us loses our cargo or our inventory, we're not out of business. During the 1700s and 1800s, a lot of insurance companies were formed through captives. When you think about farmers insurance, for example, they were formed by farmers that came together and said, hey, we want to insure against our crops. So that was kind of the onset of captives, is how can a group of individuals come together to diversify the risk. The term captive was coined back in 1950, and it really exploded in the 1980s on the commercial side because of the hard commercial market that was going on at that time. Captives are very common in the commercial market when you think about workers' comp or some of the other captive pools that are out there. A lot of them exist on and have been around for a while, and maybe a lot of your CFOs and risk managers are familiar with captives, again, on that commercial side. But we've seen an increased trend now in that coming over to the health side as well. So on the health side, captives are self-funded plans. What they do is they are designed to maximize the financial leverage through pooling and sharing of risk, much like they would do on the commercial side. And what captives do is they provide a primary layer of stop loss prior to the traditional stop loss. So there's a middle term, and we'll get into a little bit more on a diagram here in a second. But essentially, they add an additional layer of pooled risk amongst you and other employers that are part of the captive prior to it being transferred out to a stop loss insurance carrier. The traditional stop loss is purchased on behalf of the entire captive, so that gives you the purchasing power of a large group. Each employer in the captive is allowed to, again, still set the risk that they want to take. Usually this is between a $25,000 and $100,000 corridor. So again, we're talking that specific stop loss insurance on each individual within your population. For the most part, at least the captives that we work with at Hausmann Johnson have written in that they do not do lasering. So I mentioned earlier that self-funding, one of the disadvantages of lasers, because the purchased amount of stop loss or the traditional stop loss is set at such a high mark, lasers really don't come into play. This is a huge advantage for these smaller employers that are looking at self-funding, and we'll talk a little bit more about this in a second. Know that each employer that's within a captive is individually rated based on their risk share, size, and experience. And that's going to determine how much they're going to contribute into the captive pool. So when you look at the overall, I guess I'll get into this in a second. So the captive funding arrangements are, they have no effect. The last bullet point there is just that your average Joe employee has no clue that you're part of a captive as the employer. It doesn't affect his coverage or the how he perceives the insurance. So when we look at the captives on a visual, really the orange box there is the amount of the risk that the employer is taking on. So in this example, it's set at $50,000 on an individual basis, and then there's also an aggregate amount that you would have. So very much like a traditional self-funded plan. What this does is it allows you to purchase insurance down to that $50,000 mark. As what we've seen in recent years is that the stop-loss market, it's tough for an employer of 100 employees to get a $50,000 stop-loss. And if they are, they're paying a lot for it. What this does is that pool, that purple part, is everyone within the captive puts aside some money based, again, on their experience, where their stop-loss is set at, whether it's 50, 25, 100. They're going to put aside some money into this captive, and what it does is it pools all of the money together from everyone that's part of the captive, and then any claim that's incurred on any one of your individuals or any other individual that's part of anyone covered through the captive is paid from that risk-sharing amount. And then the final layer in that blue layer is that's the risk shift, that's the reinsurance. So instead of you as an employer on an individual basis buying a reinsurance policy at $50,000, the captive as a whole buys in a reinsurance policy at $300,000. And then again, anything between the $300,000 and the $250,000, that $250,000 risk, that is pooled amongst everyone that's within the captive. And then there's also that captive reserve. There's that element of reserve that the captive needs to hold in order just to make sure that they have enough money to pay the claims that they need for exposure. So when you look at how it's broken down, again, from an employee standpoint, the employee doesn't see the funding behind this, but from you as the employer, you're going to have a set amount of risk. There's going to be a set amount of money that you contribute into the pool, and then there'll be a set amount of fixed costs that you're going to contribute to the reinsurance carrier as well. So I just kind of went through each one of those, but again, the risk-taking part, that's to determine how much risk you're going to take as the employer. The risk-sharing is how much you contribute into the pool, and the risk-shifting is how much you're paying for that catastrophic or that stop-loss coverage on the captive as a whole. The surplus at the end of the year, if there is a surplus within the captive, is shared with the captive employees. This varies amongst the different captives that we work with, but just know that that money is given back to the employers who participate in the captive, and it's either done so on a credit basis or sometimes a cash check as well. And it really is going to determine not only based on the captive's performance, but you as an individual employer, how you perform. So at the end of the year, that money is given back, or it's used again to build up the reserves that are used to fund future years' exposures within the captive. What that does, and one of the nice things that we've heard feedback from employers about, is it creates this community of employers working together to maximize their healthcare dollars. Captives really become a way for employers to share best practices, to learn from one another. A lot of the captives that we work with actually have workshops. They have annual meetings. They have education summits on behalf of their members to get together to learn about best practices, some of the new trends that are out there in the marketplace. They learn about new vendors that are out there and ways that they can manage their healthcare costs. So you have this group effort that again, when we talk about the purple box here, you as the employer and everyone that's part of that captive, it's really your goal to figure out how can we reduce the amount of claims being paid out of that bucket so that at the end of the year we get some more money back. This is just another way to look at it when you're comparing a captive plan to a self-funded plan on a standalone basis. Really what happens is the captive allows you as the employer to take on less risk. So you can see the orange box goes down within the captive plan. So again, you're taking on less risk on your shoulders as an individual employer. It allows you to fund that specific stop loss at that $25,000 or $50,000 range, which can be very difficult to purchase on a standalone basis as just you as one employer. The captive also allows you to benefit from the group purchasing of the stop loss premium. So when you look at the fixed cost amount under that stop loss premiums in the blue box, that goes down because, one, you're buying it at a higher level, being maybe $250,000 or $300,000 versus $50,000 on a standalone basis, but you're also buying it on a population of maybe 20,000 employees versus 100 employees. So you're able to use that purchasing power to pay a much lower rate. And also one other thing to note is that the excess in that captive layer, like I had mentioned just on the previous slide, is returned to employers. So the target loss ratio for stop loss carriers is anywhere between 60 to 70%. So that means in that blue box there, they're looking at only paying out 60 cents on the dollar that you give into them. So the most, so what we want to do is, or what captives allow you to do is really minimize that blue box, because that's less, that if you think about that 30 to 40% profit or 30 to 40% excess that's going back to the stop loss carrier, if we move a bunch of that into the purple box, into that captive premiums, then that money, instead of going back to the insurance company, is going to go back to you as a participant within the captive. Another benefit of working with captive is, for the most part, captives allow you to select your own pieces to the puzzle when it comes to building your self-funded plan. So you're able to set up your arrangement with your own third-party administrator or TPA, your own pharmacy benefit manager. You get to pick the networks that work best for you and the locations you have with your employees. You get to choose case and disease management vendors, health risk assessment and wellness vendors. All of that is independent from the captives. Now, some of them may have preferred pricing arrangements set up. We've seen that in the past. But the only piece that you group purchase within the captive is the stop loss. Everything else, you have that flexibility of a self-funded plan of really finding who works best for you and your geographic location and where your employees reside. So who's a good candidate for a captive? Really, when we look at who might be a good candidate from an employer standpoint, first and foremost, I think you need to be in that 50 to 300 employee range, and that's covered on the health plan, not just total employees, but you want to think about the employees covered on the health plan. If you're above the 300 range, captives might work, but a lot of times even the captives themselves will say you're large enough that more than likely you're able to self-fund on a standalone basis. Really, again, these captives were set up for this mid-market group, that 50 to 300, where employers didn't feel comfortable taking on the risk that they needed to in order to be completely self-funded on a standalone basis, but still wanted to take advantage of many of the advantages of being self-funded. Again, we talked about this earlier when we were talking about your evaluation, but you need to have a stable workforce and potentially a growing workforce. Again, you don't want to be in that downsizing mode or being worried about layoffs or having a reduction in your population, because that could have an adverse effect on your plan and the plan performance. Also, you want to be a strategic long-term buyer. Self-funding in itself is a commitment, as well as captives are, being a self-funded plan. So again, this isn't something, if you're thinking about joining a captive, like, oh, we'll try it out this year, and then if it doesn't work out for us, we'll go back to a fully insured plan. Really, to see the value of a captive or a self-funded plan in general, it really needs to be that long-term commitment. You need to be into it for the long haul. Oftentimes when we talk to employers that have looked at captives and are looking and signing up with captives, they're fully insured and they're frustrated with the system. They're frustrated with the rate increases, the lack of information that they've been given, and they want a different option. And captives is a way to bring that option to them. Also, these employers would be focused on risk management with wellness initiatives. A lot of times these captives themselves have a big push in wellness, using the risk management that they've learned, best practices. Some of them, and some of the things that we've heard from employers when we talk to them about captives, one of their concerns is that there's a lot of hoops that you need to jump through in order to be part of a captive. That can be true, but that's also a little bit misleading. Some captives say you need to offer a health risk assessment and you need to have some kind of wellness plan in place. Well, you know, when we go out and we look at our marketplace right now, that's the majority of the employers that are out there, so that's not a big hurdle for them. The last point there, I think, you know, is the executive and the human resource professionals. If you're a good candidate for a captive, you need to be looking for new ideas. You have to be frustrated again with the status quo of the 8 to 15% increases every year, looking for something different, wanting to kind of roll up your sleeves and take a little bit more hands-on approach, because again, these captives are self-funded. There is a little bit more work that falls on you as the employer, and that needs to be acknowledged up front, but also is a very good opportunity for you to do some things that you're not able to do with a fully insured plan. So in summary, when we talk about captives, captives provide a more financial efficient platform with 80 to 85% of the healthcare spend being variable. So it allows that, again, variability, not having everything set up in fixed costs, but having the stability of being able to reduce your risk by lowering the specific stop loss in each individual that you have in place. It also allows participants to pool their risk and share in the underwriting gains. So again, versus it being outsourced to an insurance company, you as the employer are also the owner in the captive, so you get to benefit any of the rewards at the end of the year for performance that exceeds expectations. It also gives participants the ability to plug and play the best in class, like I just talked about. So you're able to still determine who the best TPA, who the best network is for your employees, but be able to group purchase that stop loss. Also allows you to avoid a lot of the new components of ACA, the federal and state premium taxes. It gets away from this community rating that we talked a little bit about, that we know a lot of employers in the 50 to 200 marketplace are frustrated with, especially if they've seen year over year that their plan experience has outperformed the community rating. Again, getting into a captive, if you're a group that you can look back at your last couple of years renewals and see that your group's experience is better than the community rate in the renewal calculation, you are definitely a good candidate for a captive. And then also, you know, you don't have to deal with the state mandates, and again, that is really important for those groups that have multi-state locations. Another benefit that we talked about is that the employers have access to stop loss rates that are a lot more stable and predictable than maybe what you'd be able to get, or definitely than what you'd be able to get on your own, especially for that group in that 100 employee range. And it also allows you to still be flexible with how much you set at your own individual risk level. So a lot of employers, when they join a captive, might pay a little bit more into the pooled captive premiums and have their risk share start lower, maybe at $25,000 or $50,000. But after they've gotten a little bit more comfortable with self-funding, a little bit more comfortable with how captives work, they creep up towards that $100,000 range. So captives allow you to still make those changes within the amount of risk that you want to take on while still being part of the captive. Another great benefit of captives is that you get access to the reporting and you get transparency of claims experience for not only you but also as the captive as a whole. So you get to see how your group performs. You also get to see how the captive performs. And finally, that you know, captives are great tools to help employers gain more control over their health plan and the cost. It's really something that we've seen a lot of employers embrace, is saying that they want to change, they want to do something different. And our captives are a way for them to bring the self-funding to this mid-marketplace. So if you want to learn more about captives, you know, it's pretty simple. It's very similar to what you've gone through in the past, either if you worked with Hausmann Johnson or if you worked with a different agent or broker. On getting alternative quotes, whether it was a fully insured or self-funded plan. Really, it's just a detailed census, 3 years of premium and claim history, and again, we understand from a fully insured standpoint, your claim history might be limited, and then a current copy of your plan or policy. And I would just encourage everyone on the line today, if you're a current client, or if you're not a current client, if you want to learn more, or if you want to see how a captive pricing model might compare to what you're currently paying, feel free to reach out to myself or anyone on the Hausmann Johnson benefit team, and we'd be happy to discuss this a little bit more with you. And with that, I'm going to open it up to some of the questions that we've had and go from there.
Okay, so during the presentation, we received a question that is, how does a captive relate to the old partially self-funded plans?
So the old partially self-funded plans, I would put in that level funded bucket. So the difference is, again, you're on a standalone basis with those older plans. The partially self-funded plans, again, essentially they set up a premium that you would pay, and then if you would perform better than that throughout the course of the year, you had some potential to get some money back. There also, like I said, was some of the risk corridor where you might have to pay some additional money at the end of the year. What the captives do, which is a little bit different, is essentially that middle layer, that purple layer that we talked about, the captive pool, you as the employer become an owner in that captive, and you get the money back, and you have financial responsibility. Now, for the most part, the organizations that we've worked with as it relates to captives, they're third parties. They have employees there that manage these captives. They offer many different captives. Some of them are industry specific, some of them are not. What they found within these captives is that there really isn't a benefit to having industry specific captives like there are on the commercial side, because a risk of your population, a heart attack is a heart attack, so to speak. So it doesn't matter whether you're teachers or engineers or electricians, you're all, virtually have the same health risks. So it actually helps with what some of the captives have seen. It helps to diversify that risk pool a little bit more amongst the employers. But I would say the difference between a captive and these older plans is that you, as the employer, are an owner in the captive, and you own a lot more control in how that captive is managed and that partial self-funding piece is managed.
We had another question. Jim asked, are captives regulated by the Commissioner of Insurance?
Captives are regulated by ERISA because they are considered self-funded plans. So individual, so the Wisconsin OCI doesn't have any regulation over captives. Now, captives need to apply to be able to have employers sign up to be participating in them within different states. But for the most part, they go mostly unregulated, I would say, by the OCI.
That's all the time that we have right now. I'm going to pull up Jesse's information right here, just in case anybody does come up with any more questions. Please feel free to either call him or email him. So I'll leave this up for 30 seconds, and then I'll pull up the SHRM and HRCI credits, and then we'll end the webinar. Thanks, everybody, for joining us.
Thank you.